As always, a very warm welcome to all of you. I'm Dr. Mukhmohit Singh, and today I'm glad to welcome you all for this very important and much sought after topic discussion. We are going to talk about rabies. A lot of questions come on rabies, and a lot of queries come every day on rabies. That's the reason I thought of discussing this topic today. And the source of my lecture today would be a simple. We had 2019 National Rabies Control Program guidelines issued by the NCDC, National Center for Disease Control, and the advisory issued by the Ministry of Health and Family Welfare 2019. So, based on that, we are going to talk about rabies. Before I talk to you about rabies, see, I'll be discussing 10 points with you. So, I'll give you 10 points. You have to remember those 10 points. That's all. But before I talk to you those 10 points, I would like to discuss with you that in year 2004, as per the WHO estimates, there were 17.4 million animal bites. If you talk about these 17.4 million animal bites, then in our country, in India, the anti-rabies vaccine intradermal schedule, if we are giving, is not sufficient. It won't be sufficient at all. It is not sufficient. But on the other hand, the good news is that if we talk about the reported animal bites, in that case, that means the reported animal bites are lesser than the estimated animal bites. If we talk about the reported animal bites, in that case, intramuscular injections or intradermal injections both would be sufficient. Why did I tell you this? I'm telling this that because based on this, you will understand that why in India it is different schedule followed from the WHO schedule is different. In India, the schedule is already different. So let us start with the 10 points. I'm going to talk to you point number one. Point number one is about wound washing. If you talk about wound washing, what is the MCQs? First is it is the best way of prevention. Best way of prevention. Of course, not more than the anti-rabies vaccine, but it is one of the most cost-effective ways of way of prevention. 50 to 60% or even more chances or probabilities of infection to spread through the body is negated by simple wound washing. MCQs on this. How would we do wound washing? Is it only with soap or with water or with both? Answer is with both, soap and water. For how much time are we going to do wound washing? Answer is at least more than 15 minutes. We need to do wound washing. In which water are we going to do wound washing? We are going to do in a clean running water. Clean running water more than 15 minutes and soap and water both. Point number two. This is the most important sought after point. I think you all have been waiting for this, about the post exposure prophylaxis. See, whenever I talk about the post exposure prophylaxis, I will write down PEP. PEP technically means post exposure prophylaxis. If I'm going to talk about the pre exposure prophylaxis, then I'm going to write down pre exposure prophylaxis. PR, something like this, PREP. This is what we write for pre-exposure prophylaxis. So most of the time students are confused, like, sir, you're saying PEP, what does it mean, post or the pre? PEP means the post-exposure prophylaxis. In India, the post-exposure prophylaxis recommended by the National Center for Disease Control, NCDC, by the Ministry of Health and Family Welfare, by the National Rabies Control Program, all across the places, there are only two schedules which are followed in India. One is the intradermal Thai Red Cross regime. Second is the intramuscular modified SN regime. I know that you already have been taught about the Institute Pasteur Decomposed Schedule, IPC schedule. That is the Institute Pasteur Decomposed schedule. I know that you know about the IPC schedule, which is on day 0, day 3 and day 7. But this is the WHO schedule given by the WHO and is not being followed in India. It is not followed. IPC schedule. Many districts have adopted the IPC schedule on trial basis because based on the India is one of the participating countries for trials on the Pasteur Decomposed schedule. So henceforth, many districts are following IPC schedule, but as per the NCDC guidelines, in simple words, for your MCQ exams, please remember you need to mark these two schedules only: the intradermal high red cross schedule and the intramuscular modified SN regime. Out of these, which one is more commonly advocated? It is always the high red cross schedule because it requires lesser amount of the vaccine. It is only 0.1. So, what is the Thai Red Cross regime? The Thai Red Cross regime is two doses, two, 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 and a two. So, this is two, 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 nothing, that is zero, and again a two. This is what is 4 visits, 8 doses, because two on each day, and this is what is the Thai Red Cross schedule. So, in this, you are giving two vaccines, dose is 0.1 ml. So you take out in the syringe, the insulin syringes we are using. In that insulin syringe, you take out 0.2 ml. You take 0.2 ml, half you put in this side, half you put in this side. So in both the shoulders, we are going to put 0.1 ml. The dose is 0.1 ml intradermal, 0.1 ml intradermal anti-rabies vaccine. In case it is, we are also giving category 3, we are also giving the rabies immunoglobulin. In case we have to give rabies immunoglobulin, it is given on day 0 along with the 0 dose, but it's not like you put it on a separate day. So anyways, for your exams, you need to remember the updated Thai Red Cross schedule, that is 2, 2, 2 and another 2, day 0, day 3, day 7 and day 28 updated Thai Red Cross schedule. In case you want to talk about the modified SN intramuscular regime, this is the SN intramuscular regime. The SN intramuscular regime is for 5 doses and for 5 visits. We are giving only single injections. So one, another one, and one injection. So these are 5 visits, 5 doses. Why don't we say any number like 0.5 ml or 0.1 ml or something like this? Because in intradermal, I told you it is 0.1 ml. But over here, we don't have any 0.1 ml or 0.5 because different vaccine manufacturers make, there are two types of intramuscular vaccines available. We can either have a 0.5 ml intramuscular vaccine, or we can also have a 1 ml intramuscular vaccine. So different companies have different formulations. Don't get into that stuff like which company is giving what, because that may change anytime as per the DCGI approvals. But you need to remember that the full dose of the intramuscular vaccine has to be inserted. So there are 5 doses, 5 visits, one on each day. What are the days? You have to remember day 0, day 3, day 7, day 14, and day 28. These are the days for the intramuscular SN schedule. So please remember that we either have the updated Thai Red Cross schedule, or we can have the intramuscular SN schedule. So that was your point number 2 about the post-exposure prophylaxis. Next, let us come to the point number 3. This is also very frequently asked question to me on social media, like what do we do in case we are to change brands? In case of changing the brands, what should we do? So in case you are changing the brands, is it advised or not advised? So first thing is, it is not advisable. It is not advisable to change the brands or to change the type or to change the manufacturer company of the anti-rabies vaccine. So if the WHO recommends that, usually this should be avoided. But in some cases, it becomes unavoidable. Let us take an example. A traveler coming from US comes to India, he gets a dog bite, and he gets the first vaccine in India, and now he needs to move back to his home country, and over there he will take the other doses of the vaccine. So in those cases, he won't be able to carry the vaccine from this place to US. Probably they will have to change the brands. So is it necessary to restart or to resume? Answer is, in case you're changing the brands or the type, shifting from intradermal to intramuscular or intramuscular to intradermal, whatever it is, please remember we resume the schedule. We do not restart. You only continue the schedule, you do not restart the schedule. Next is the point number 4. Let us talk about another thing which is again very frequently asked, that is about the re-exposure prophylaxis. Re-exposure prophylaxis, again a frequently asked question. So first is, what is the schedule for re-exposure prophylaxis? The schedule for re-exposure prophylaxis, we can either give intradermal injections or we can give intramuscular injections. So whatever it is, whether we are giving intradermal 0.1 ml, the intradermal vaccine vial, or we are using the intramuscular, whatever it is, you have to give a single site, that is one site, on day 0 and day 3. So we are supposed to give when and when single site on day 0 and day 3. This is the re-exposure. The MCQ comes, who will get a re-exposure? Of course, who gets a dog bite again will get a re-exposure. So who is going to get the re-exposure vaccine? Of course, after the dog bite. Please remember, these are two types of people. It has to be in case they have taken complete pre-exposure prophylaxis, or they might have taken a complete post-exposure prophylaxis. In all these cases, if it is more than 3 months, only then we are going to give the ARV, anti-rabies vaccine, as re-exposure prophylaxis. So anti-rabies vaccine is only given if the vaccine was taken more than 3 months ago. If it is within 3 months, if unfortunately the dog bites within 3 months, that's so bad. But in case if the dog bites within 3 months, only wound washing is recommended. Only wound washing is recommended. Not even we don't even need to give the rabies immunoglobulin to such people. So that's actually your point number 5. If we talk about the point number 5, that in case of re-exposure or in case of animal bite within 3 months, the thing that we have to do is only wound washing. Wound washing alone is important for animal bites happening within 3 months. Of course, that's bad. Point number 6 is, let's talk about the rabies immunoglobulin. If you talk about the rabies immunoglobulin, now the recommendations are, of course, it had been earlier as well. The recommendation are that infiltrate the maximum amount of rabies immunoglobulin in the wound area, and remaining, whatever you cannot infiltrate within the wound area, the remaining should be given by intramuscular injection to the nearest site, from the wound. So technically, what in nutshell, what this point number 6 I want to say is that rabies immunoglobulin, many students have been asking, do we give it half and half, or 30-70 or 70-30? You can always take it for granted. You try to give almost 100%, but at least give more than 70% in the wound, just around the wound, in and around the wound, and very little should be kept away from the wound, like giving extra. In case you have extra, you give it in the intramuscular area, just near to the wound, whatever is the designated intramuscular site available nearest to the wound area. So having said so, next point number 7 is still on the rabies immunoglobulins. I want to reinforce this point that rabies immunoglobulin is given to all category 3 animal bites. It is not in accordance in India as per the NCDC guidelines. India does not follow the WHO guidelines of prioritization of rabies immunoglobulins for category 3 bites, that the RIG, rabies immunoglobulin, should be given only once in lifetime and so on. So in India, so sab log le rahe hain rabies immunoglobulin, and that's part of the module as well. That all category 3 bites should get rabies immunoglobulin. Of course, not those who have done within 3 months. Animal bites within 3 months, they are out of the repeat rabies immunoglobulin. And also, I would like to tell you, since we are talking about the rabies immunoglobulin is advised in case of patient in HIV or who is compromised, in those cases, we are going to give rabies immunoglobulin to all category 2 and category 3 animal bites. In these people who were HIV or immunocompromised who get an animal bite, we are giving category 2 or category 3 rabies immunoglobulin. And we are also, do you notice that we are also giving all the vaccines, all the anti-rabies vaccine should be intramuscular schedule. Complete dose schedule, intramuscular high dose schedule should be taken care. In immunocompromised, do you also know, lateral MCQ, do you also know that once immunocompromised patient is there, after the completion of the vaccine schedule, after 14 days, we should get an antibody titer done. Antibody titer after 14 days of completion of the anti-rabies vaccine schedule. So in the immunocompromised or in the HIV cases. So that's about the rabies immunoglobulin. Next is, let's talk about some of the points about the other points. Point number 8 is about the monoclonal antibodies. So right now it is under research. Monoclonal antibodies is under research, and there is no guideline that are we supposed to give or not give, or how we are supposed to give the monoclonal antibodies. Point number 9, let us talk about the pre-exposure, prophylaxis. What is the schedule for the pre-exposure prophylaxis? For pre-exposure prophylaxis, we can either give an intradermal vaccine dose, that is 0.1 ml, or we can give intramuscular full vaccine dose, full dose. Both are given as one site. Both are given as one site on day 0, day 7, and followed by that day 21 or day 28. So there are 3 doses as pre-exposure prophylaxis given by the NCDC guideline. This is the NCDC guideline. The NCDC guideline are 0, 7, 21 or 28 vaccine schedule. In WHO, I know it is 0 and 7 only. 0, 7 pre-exposure prophylaxis, but this has been updated by the NCDC. So I want to reinforce the point that NCDC guidelines are pre-exposure are 0, 7, 21 or 28 days. These pre-exposure guidelines are also applicable for, these are for all the travelers who are traveling to endemic areas from non-endemic areas. They are also applicable to laboratory technicians who are working with the virus, or who are dealing with the patients. These are also for the healthcare workers, patients in case of the rabies ward, or who are dealing with animals, right? It is also applicable to the healthcare professionals, healthcare workers who are dealing with these patients, rabies patients, and it is also applicable to wildlife officers or people who are vets, who are animal handlers in those cases. In certain cases, Indian Academy of Pediatrics, they also recommend rabies pre-exposure prophylaxis to children in high-risk areas where there is known endemicity of rabies or animal bites. In those cases, children may also take the pre-exposure prophylaxis, right? So these all are very important, and in case patient is taking, I would also like to inform you that in case the people are taking pre-exposure prophylaxis, on day 0, 7 and 21 or 28, in those cases, it is advised that they should get a neutralizing antibody test, neutralizing antibody titer done every 6 months. Antibody titer done every 6 monthly, and if the antibody titer is less than 0.5 international units per ml, less than 0.5 international units per ml, that is the point where we need to take a booster dose of the vaccination, of the pre-exposure prophylaxis, single dose. So just to summarize the whole story, not taking too much of your time, I would like to reiterate the point that post-exposure prophylaxis, intradermal, intramuscular, 0.1 ml you have 0, 3, 7 and 28, and intradermal is 0, 3, 7, 14, 28. It is 5 doses. Intramuscular is 5 doses. Intradermal is 4 visits, 2, 2, 2 and another 2. In case we are going with the pre-exposure prophylaxis, that is before any animal bite, in those cases we can either give intradermal or intramuscular, that is single site, one site. So it is single site, and day 0, day 7 and day 21 or day 28. Day 0, 7 and then another booster on day 21 or 28. If we are finally talking about the re-exposure guidelines could be given as intradermal or intramuscular injections, and intradermal is 0.1 ml, but intradermal is one entire vaccine. So we are not bothered with 0.5 ml or with the 1 ml dose. The re-exposure guidelines is given 2 days, 2 doses, day 0 and day 3, and it is single site, and two number of visits would be 2. So 2 visits, 2 doses of vaccine is given in case of re-exposure prophylaxis. I hope we all know that in infants and small children, anterolateral aspect of thigh is used, whereas in adults we will be using the deltoid muscles are used, right? So with that, I would like to thank you so much for watching me again, and I wish to bring you again and again more informative stuff on most of the communicable diseases or any of the updates we have. If you like this session, please subscribe to my channel and hit the bell icon. On Facebook, you can find me on Mukhmohit DR as a Facebook page, or you can visit our websites mukhmohit.com or psmsimplified.com. Thank you so much. Keep your revisions in time, and all the very best.